Okay, let's get this over with before we start. If you think COVID is over, it's not. And for some people, those who've been left with long COVID, like Renee and John, it won't be over for many years, perhaps for the rest of their lives.
My life turned into lying on the couch in the living room with my commode chair next to me so that I could slide off, do my business in a bucket, slide back on the couch, and lie there for that.
The worst period was losing mobility, and I think I'd describe it. It's like the wiring between my brain and my feet broke. So, your feet tell you when you're on uneven ground. So mine stopped telling me, so I just kept falling over the whole time.
And the curtains would be shut so that the neighbours couldn't see me when I went toilet. And I lived like that, lying next to my pee bucket all day, every day, for months.
I don't think there's been any real thought of, we've been through this battle, but there are these casualties, and we're going to have to find a way of looking after them.
I'm Alexia Russell, and today on The Detail, Newsroom's senior political reporter Mark Dalder talks to me about a new report on long COVID. It's one of the few pieces of work being done in New Zealand in this area, and the first attempt to try and create a comprehensive registry of the people here who haven't been able to shake off the pandemic. But it seems people just don't want to know anymore.
People talk about COVID fatigue, and when they say COVID fatigue, they don't mean long COVID fatigue, right? They mean, I'm so sick of hearing about COVID because we had these long lockdowns and it was really burdensome. And it was. But to some extent, we've swung too far on the pendulum. And now we find ourselves unable to even acknowledge that things like long COVID happened, that COVID is still, a virus. 1,000 people died from COVID last year. 3 times more than you'd have from the flu in an average year. 3 times more than the road toll as well, by the way. Given that, you'd think that this would be a bigger issue, that people would talk about it more in government and outside, but there's such a cultural kind of wanting to forget power and effect in place that I think that, contributes to just not wanting to acknowledge that it's real.
But it is very real.
Long COVID is tipped to become a leading cause of disability in New Zealand.
It's estimated there could already be 200,000 people with lingering COVID symptoms, and experts say that case numbers will keep climbing because of reinfections.
As the world tries to move on from the pandemic, millions of people continue to battle long COVID symptoms. That includes thousands of New Zealanders.
There has been other research that looks into one particular aspect of it, or research that looks at COVID more broadly that wraps in some of the experiences of people with long COVID. But this is really a very focused effort to understand what's the burden of long COVID on New Zealand and on the people who have it.
And what is the key thing to emerge from this?
I think there's a lot to emerge, but I think maybe the big thematic result is that, for people who have long COVID and who participated in this registry, it has a very serious effect on their quality of life, on their ability to do the things that, we take for granted as day-to-day things, even things like walking and talking or being able to clothe yourself. And it also has a flow-on impact at a macro level on New Zealand as a society. We have very productive people. I've spoken with, former city councillors, students who are training to be doctors, health and disability workers who now find themselves unable to work. And what impact does that have when in New Zealand, we've already got a shortage of doctors and health and disability workers?
So, because this is so new, emerging from still relatively recent pandemic, what are the issues relating to that? Has it, for example, has it been a battle for sufferers to be recognised that they have a continuation of, SARS-2?
Yeah, I think in the very early months of the pandemic, thinking back to March and April 2020, there were people who caught COVID and they had some of these lasting after effects, but we still knew so little about the virus that it was hard for them to, realize that there was this post-COVID syndrome, this long COVID, that it even existed. After that, there kind of became an understanding that yes, this could happen, and it happened, more frequently than you might expect. when COVID vaccines came in, there was a hope that it would drastically reduce the kind of prevalence of long COVID. And while it seems like potentially there is, you're less likely to get long COVID if you catch COVID while you've been vaccinated, New Zealand's experience, where we had almost all of our COVID cases after being highly vaccinated, shows that it's not impervious. That there are still a lot of people who do come down with long COVID after their initial infection.
Has anyone looked at overseas cases to work out that vaccination did or didn't mitigate the severity of symptoms?
Yeah, they have done that sort of research, and it does appear that vaccination does lower the risk of long COVID and the severity of it if someone does develop it. Antivirals that we provide to people who are particularly vulnerable also appear to have a similar effect. And so there's a reduction effect there, but it's not a reduction to zero. And there's still estimates that range from, it's a wide range, but between 2 and maybe 15% of people, even if they're vaccinated after COVID, reporting some kind of long-lasting symptoms, say 3 or 6 months afterwards. It doesn't have to be debilitating for that to show up in those statistics. So it might be people who, just lost their sense of smell for a while and it took quite a bit longer for it to come back. I think we all know people who've had some brain fog and some fatigue issues after getting COVID, but recovered after a while. But there is a number of people who have this much more debilitating experience where it lasts for a lot longer and the severity of it is much greater as well.
And do we have any sort of grasp on what the numbers might be of the latter, those sort of people who have severe long COVID?
Unfortunately, we don't. It's quite hard to study because you need to, A, have the funding for it, and the funding for COVID-related research has dried up quite significantly. But B, picking your right controls, whether you're trying to figure out, that vaccination effect and accounting for that, it's a complicated endeavor. And so the best we've got at the moment is this long COVID registry report, which was, advertised and people would self-enroll. And it showed for the people who did enroll, quite a significant percentage of them had really serious impacts on their quality of life. But there is a question as to whether there might be a much greater number of people who have, these shorter term experiences or less severe experiences who maybe didn't think of themselves as, eligible for this and didn't enroll. So we know that it's out there. We know that there are probably thousands at least of people who have had this much more serious experience of long COVID, but the specifics we won't know unless there's a serious effort to go out and find them, which would cost money.
A lot of them are really scared to come out, and I don't blame them. The bullying is pretty substantial, and most of them are suffering from their community or their whānau or even within their workplaces, not believing them or supporting them. People they've got horrific stories, and they're traumatised, and so they need people to be able to step up for them and advocate for them.
This is Janine Crossan, probably our highest profile long COVID sufferer, speaking to The Detail in August 2021 about what was then a fairly new development. Advocacy has become her life.
Well, we have two support groups. One is for long COVID, so for the people who don't recover and find themselves lingering symptoms over a long period of time. It's a closed group where they can come in and they can connect with other people and get access to resources.
Yeah, so Janine runs, I think, the Long COVID Support Network, I think it's called. There's a website and a Facebook group and so on, and she's involved in some of this research. She was listed as a co-author on this report, helped get people to enroll and I think advised on, how to frame the questions in a way that might get the most useful data and also maybe doesn't put too much of a burden on participants because, some of these participants are people who really can't focus on a screen for more than 20 minutes at a time. Making sure that the way that the survey is delivered to them is accessible is an important part of that.
What are the risk factors, the biggest risk factors for people who get COVID and then may go on to develop further symptoms?
There is some evidence that suggests if you have a more severe case of your acute COVID, you're hospitalized or something like that, you're more likely to end up with long COVID as well. But again, there are many, many cases of people who have a breeze with their COVID case initially and then experience quite debilitating symptoms in long COVID. So that's one of those risk factors is the severity of the illness. And we know the risk factors for having a bad time with the illness are things like, not being vaccinated, but also other comorbidities, poor health, Māori and Pacifica people are also much more likely to be hospitalized with COVID and to die from COVID as well. Those are the sorts of risk factors for long COVID that we're aware of. There's a lot of research that is going into, is there something, genetic, physiological, some sort of what's called a biomarker that we can find that shows that someone has long COVID, because right now there's no easy way to, just give someone a test. It's a very complex illness or syndrome, or maybe a combination of different things that are going on in the body. And also maybe whether, if you can find that, it might lead to understanding what are the biological risk factors for long COVID in particular.
Does it tend to display itself in women more than men or not?
It definitely does, yeah. That's something that's been observed in international research.
Most people who get COVID won't die, but some of those newly infected people are going to have health issues for a long time. And women may be around 50% more likely to develop long COVID. That's the finding of researchers at King's College London, who reviewed data from nearly 7,000 people in health surveys, as well as the electronic health records of more than 1.1 million people diagnosed with COVID-19.
Women are much more likely to report that they have long COVID. In the long COVID registry, I think about 75% of the participants were women. And we know that women have a harder time getting listened to by the health system, that their pain and their issues are more likely to be dismissed by doctors and by, medical personnel. And I'm sure that that's part of this whole difficulty in getting long COVID to be recognised as a problem and as something that needs the attention that something that has this size of impact on this size of the population might otherwise receive.
Can you see this running along the early days of chronic fatigue syndrome, where their symptoms were just kind of dismissed?
Yeah, it's absolutely very similar. And people who have ME/CFS, chronic fatigue syndrome, are frequently some of the most outspoken advocates for people with long COVID, because they've had to go through that similar journey of experiencing something but having it be basically ignored or downplayed or dismissed by the medical profession. And it's worth noting that my understanding is ME/CFS is another risk factor for getting long COVID. So if you have ME/CFS and then you catch COVID, you're more likely to develop long COVID than if you hadn't. But it is the complexity of the symptoms, right? So one person I spoke to, Amy, she lost the ability to speak, and they ran tests. It wasn't a stroke. It happened after being hospitalized for COVID. She had other long COVID symptoms as well, but it took a very long time to find a neurologist who's willing to say, yeah, I think this is related to the long COVID. She's perfectly cognitively developed. I did my interview with her via email because, of course, she couldn't speak, but she just can't talk anymore. And you look at that and you do maybe have some understanding for how a doctor who's not specifically read the latest literature on this might go, I don't really see how these two things are connected. We also saw a kind of phenomenon, less so these days, although it's still sometimes occurs in the medical profession, of doctors and nurses saying, basically, isn't this all in your head, right? Sizable minority of the people enrolled in the registry who say they have long COVID haven't been able to get a formal diagnosis from a doctor. And often it's because there's an unwillingness to diagnose someone with something that the doctor maybe fully doesn't understand themselves.
I ended up having some blood tests done and got an appointment at the hospital. And that's where a young doctor ended up saying, hey, it's good news. We don't see anything in your blood tests. It looks like you have fibromyalgia. And I was like, firstly, how's that good news? And secondly, what even is fibromyalgia? He was wrong. I remember my husband and I left that appointment totally stunned because he didn't even give us any pamphlets or anything on what he told us to Google it.
And that can be a very expensive and exhausting process, I assume.
Absolutely. I mean, if you go to your GP and they say no, but you're confident you have it, and then you go to another GP and another GP, that all adds up. And the study found that people were spending, on average, at least $1,500 extra in the past 6 months just on medical care alone, on additional medical care that they needed to be able to try and recover and to support themselves, as compared to prior to getting long COVID.
The first thing he did when we went into the clinic is he looked at me and he said, so you've been sick since May? And I said, yeah. And he said, why haven't you seen a private rheumatologist? And I was like, because firstly, I didn't know that it was a rheumatologist that I needed, because I don't know what's wrong with me. And secondly, I can't afford it.
There are some obvious symptoms of long COVID, but some that aren't so clear.
There are a whole range of symptoms that the syndrome can include, including particularly low energy and fatigue, shortness of breath and cough, which of course reflects the impact of COVID on the lungs themselves, headaches, low mood, and difficulty concentrating. There may be ongoing chest pains and a racing pulse, joint pains and aches and pains, and even weakness in the muscles may continue, ongoing changes to the sense of taste or smell, and poor quality of sleep.
Muscle pain and joint pain. Someone I spoke with had quite significant pain in her back, and that was just part of the whole long COVID experience, but it's not necessarily what you think of when you hear long COVID. People have pins and needles, they have heart issues, irregular heartbeats. More than half of the Māori respondents in the study said that they had an irregular heart issue, and nearly half of non-Māori respondents said the same thing. It goes all the way down to maybe less common symptoms like ongoing fevers, earaches, diarrhea. People can get gastrointestinal issues as well. And then you do have some of these quite rare occurrences, but still happen, like Amy, who lost the ability to talk, or the way that something like fatigue might display itself is I spoke with Renee, who was a Palmerston North City councillor before she got long COVID, who can't walk anymore. So she navigates mostly in a powered wheelchair now, and that's a fatigue-related thing rather than anything else. But it displays itself as something more than what you might think of as fatigue, you're tired.
Before COVID, every minute was filled with meaningful life, every minute. And since COVID, all I can ever do is sleep now. And so it's quite hard to wrap my head around. And God knows how long this will last for.
It can have really, really serious physiological kind of effects on you. There's many more in the study, things like vertigo and dizziness. About a quarter, maybe a little bit more of respondents said, yes, I experience this, which, just sounds quite awful, being dizzy all the time.
So would the registry that sort of came out of this project, because people had to log in and put their names forward, could that be the start of sort of a fairly important record of what these people are going through?
Absolutely. So there's three things that are happening with the registry going forward. One of them is that people are still able to enroll and submit. Another is that I think maybe every 6 months people are sent a follow-up survey to try and track, how it progresses and whether people are recovering, whether they're not, whether their symptoms might be changing or their quality of life or the expense that they're facing might be changing as a result of, the changes in the progression of the illness over time. And then the third thing is that if people wish to, they can opt in, but it can serve as a cohort for further research of long COVID. So maybe someone wants to do a study on vertigo and long COVID, and they can contact the people running the registry and say, hey, can you ask if any of your participants would like to participate in this study? And so it's a very useful resource going forward for sure.
Do you think this report will help funding authorities swivel towards looking at this? You say there's not a lot going on in the area. Is more needed, more research to find out how they got it in the first place and how to recover?
Yeah, there are two things that are kind of needed from a funding perspective. One of them is more research, and that has dried up quite a lot. I've got some questions into the Ministry of Health, but haven't quite yet heard back on what they'll take from this report. But it's worth noting the Ministry received the report in June and hasn't published it on their website yet, even though they say we funded this project and we'll keep you updated on it, basically. And so the researchers basically gave up on waiting for it to be published that way and have just publicly released it. And the second thing that needs funding is actually the support for people with long COVID, right? So a lot of people struggle to get a benefit because it's not considered a disability. It kind of sits in this grey area where it very clearly is a disability, but it's just not written down as one. And in the United States, in the United Kingdom, although there are fewer of them now, there was this big explosion of long COVID clinics, right, where people could go and A, get support, and B, also participate in research on potential treatments and that sort of thing. And while there was, I think, 1 or 2 long COVID clinics in New Zealand at one stage, there are now none. And so people with long COVID will tell you that they basically feel on their own, right, that there's no real support, at least from government, for this, and maybe there is from the social sector. One person told me that she was able to get a funded wheelchair through, community and social groups, but the central government kind of focus is very hands-off, very kind of, some people might say plugging their ears and pretending it's not happening. And the other aspect is, because anyone can get long COVID and because COVID is still spreading, even if it's at much lower levels than at the worst sort of points of the pandemic, it's an uncomfortable thing to think that, you might go to a party or go to a cafe and end up sick and then suddenly find yourself confined to your bed for potentially forever, right? And so sometimes we find it easier not to think about these things, but that does a disservice to the people who have already fallen ill.
I don't have the energy at the moment to be angry. But if I was my former self, I would be fuming mad at the government, both governments, for how I ended up. I have been a community advocate since forever, and yet I'm in a situation now where no one seems to care or want to know anything about this. The fact that people are actually still dying from COVID, and no one seems to know about it. There are people who are as sick as I am throughout the country. There's lots of stuff happening, like research and things happening overseas, but we don't care. Our government right now doesn't seem to care. There is no support available for anyone, and it's disgusting.
That's it for today. The Detail is a newsroom production supported by RNZ and New Zealand On Air. Today's episode was engineered by Jeremy Ansell and produced by Gwen McClure and Davina Zimmer. Thanks to Mark Dolder and to Renee and John for allowing us to use parts of their recorded interviews with Mark. I'm Alexia Russell. Mā te wā.